Hello, everyone, and welcome to this audio podcast. This audio podcast is part of the Chromulin series. This audio podcast is part of a Spectro Intrader, and this audio podcast as part of a Storm Robotics production. Today, looking at in around indication, hematuria and indications for referral, and to iterate sort of beforehand the indications for referral in as part of sort of published works from a clinical correlation and published works from 2015. The where in where the in where the, in around the in and where the indications for referral and hematuria are concerned. The indications in our hematuria for referral in sort of the current time in the current time being in around the current time and being 2024 may differ. However, to sort of share the following. So the referral but depends on a number of factors and a number of factors, and it is important to note, however, that all recipients with visible hematuria should be referred to nephrology if glomerulonephritis or glomerular basement membrane is suspected, which should be established through, for example, a simple renal biopsy. To ensure best practice, it is important to appreciate the context in which nephrology referral is required. So additionally, some of the main indications for referral include evidence of visible macroscopic hematuria, which is a general concern, and this usually requires a sort of a fast track urology referral for imaging and cystoscopy, unless there are pointers to acute renal disease. Referral to nephrology specialist if urological investigations prove negative. Additionally, invisible or microscopic hematuria without additional symptomologies with glomerular filtration rate more than 60 ml per min per 1.73 meters squared, and then addition and also and sort of also where patients older than for example recipients older than in their older than their within their older than the four older than four decades older than 4 decades older than 4 decades, and with consistent evidence of hematuria which require referral to urology, and where recommended age and ethnicity may also vary locally, and then where patients are either less than 4 decades either less than 4 decades or more than 4 decades with a negative urological investigations, potentially require the same sort of management as CKD stages 1 and 2 recipients. But it is important to validate through screening results with imaging patients with evidence of microscopic hematuria, with other significant symptomology, uh, with other specific with other significant symptomology should be determined. That draws this audio podcast to a close. This audio podcast as part of the Chromulin series. This audio podcast as part of a Spectro integer, and this audio podcast as part of a Storm Robotics production.